Good day everyone, my name is Marigold Yang, a BS Ed Chemistry student, and today we are going to discuss about what is bipolar disorder. Let us know first what is bipolar disorder. Bipolar disorder is a brain disorder that causes changes in the person's mood, energy, and ability to function. People with bipolar disorder experience intense emotional state that typically occur during distinct period of days to weeks called mood episodes. These mood episodes are categorized as manic or hypomanic means abnormally happy or irritable mood or depressive sad mood. So bipolar disorder commonly runs in families. 80 to 90% of individuals with bipolar disorder have a relative with bipolar disorder or depression. Environmental factors such as stress, sleep disruption, and drugs and alcohol may trigger mood episodes in vulnerable people. Though the specific causes of bipolar disorder within the brain are unclear, an imbalance of brain chemicals is believed to lead to dysregulated brain activity. The average of age onset is 25 years old, but it occurs in the teens or uncommonly in childhood. Bipolar disorder is a category that includes three different diagnoses. First is the bipolar 1. Bipolar 1. People with bipolar 1 disorder frequently have the other mental disorders such as anxiety disorder, substance use disorders, and or attention deficit or hyperactivity disorder or ADHD. The risk of suicide is significantly higher among people with bipolar 1 disorder than among the general population. So, a person has a bipolar 1 can experience a manic episode. A manic episode is a period of at least 1 week when a person is extremely high-spirited or irritable most of the day or most day possesses more energy than usual and experience at least three of the following changes in behavior. These are the symptoms of bipolar 1 disorder. Decreased need for sleep, feeling energetic or despite significantly less sleep than usual. Increased or faster speech. Uncontrollable racing thoughts or uncontrollable racing thoughts or quickly changing ideas or topic when speaking. Next is the distractibility. Increased activity or restlessness working on several projects at once. Increased risky behavior, reckless driving or spending sprees. So, these behaviors must represent a change from the person's usual behavior and can be clear to friends and families. Symptoms must be severe enough to cause dysfunction in work, family, or social activities and responsibilities. Symptoms of manic episode commonly require a person to receive hospital care to stay safe. Some people experiencing manic episode also experience disorganized thinking, false beliefs, and or hallucination known as psychotic features. So the next episode is hypomanic episode. Hypomanic episode is characterized by less severe manic symptoms that need to last only 4 days in a row rather than a week. A hypomanic symptoms do not lead to the major problems in daily functioning that manic symptoms commonly cause. Major depressive episode. A major depressive episode is a period of at least 2 weeks in which a person has at least 5 of the following symptoms, including at least one of the first 2 symptoms. The first is intense sadness or despair. Loss of interest in activities the person once enjoyed. Next is feelings of worthlessness or guilt. Fatigue, increased or decreased sleep, increased or decreased appetite, restlessness or slow speech or movement, difficulty of concentrating, and frequent thought of death or suicide. Treatment and management. Bipolar disorder symptoms commonly improve with treatment. Medication is the cornerstone of bipolar disorder treatment. Through talk therapy or psychotherapy can help many patients learn about their illness and adhere to medication, preventing future mood episodes. So we are done about the bipolar 1 disorder. So now let us now proceed to bipolar 2 disorder. Bipolar 2, a diagnosis of bipolar 2 disorder requires someone to have at least one major depressive episode and at least one hypomanic episode. People return to their usual functioning between episodes. So people with bipolar 2 disorder often first seek treatment as a result of their first depressive episode, since hypomanic episodes often feel pleasure and can even increase performance at work or school. So people with bipolar 2 disorder frequently have other mental illness such as anxiety disorder or substance use disorder, later which can exacerbate symptoms of depression of hypomania or hypomania. Treatment. Treatment for bipolar 2 are similar to those for bipolar 1, medication and psychotherapy. The most commonly used medication are mood stabilizer and antidepressant, depending on the specific symptoms. If depressive symptoms are severe and medication is not effective or etc. may be used. Each person's treatment is individualized. So yeah. And the last but not the least is the cyclothymic disorder. Cyclothymic disorder is a milder form of bipolar disorder involving many mood swings with hypothymia and depressive symptoms that occur frequently. People with hypothymia experience emotional ups and downs but with less severe symptoms than bipolar 1 or 2 disorder. Cyclothymic disorder symptoms include the following: for at least 2 years, many episodes of hypomanic and depressive symptoms, but the symptoms do not meet the criteria of hypomanic or depressive episode. Next, during the 2-year period, the symptoms or mood swings have lasted for at least half the time and have never stopped for more than 2 months. And the treatment for cyclothymic episode can involve medication and talk therapy. For many people, talk therapy can help with the stress of mood swings. Keeping a mood journal can be an effective way to observe pattern in mood fluctuation. People with cyclothymia may start and stop treatment over time. Though children with bipolar disorder are often gifted, they require patience and new approaches to help them learn and grow. Here are the eight teaching strategies to help the students excel in the classroom. 8 teaching strategies. First is flexibility work best. It is best to adopt a more flexible lesson plan for children with bipolar disorder. Additional time for assignment and tests may be required and understanding given for missing classes due to appointment with healthcare professionals. Next is consistent schedules. Children who live with bipolar require flexibility with their schedules, such as incorporating many breaks throughout the day to aid with focus and staying positive. It's important, however, that this routine stay consistent. Next, few distractions. Distractions can cause more disruptive behavior and can negatively affect the student's ability to focus. Some students will need to be seated near the front of the room to help reduce the distractions. Next, practice patience. Patience. Next, practice patience. Understand that the child grades may drop or he could participate less in class activities. Practice tolerance in dealing with minor problems and instead of focusing on negative conduct, recognize and praise the positive behavior. Maintain good communication. There should be open lines between educator and schools and the child's parents, guardians, psychologists, or other health care professionals. It is important to practice good communication and be ready to adapt and try different approaches for the child if something is not working. The next strategy is have a plan. It's essential that teachers watch for extreme behavioral behavior. Next strategy is have a plan. It's essential that teachers watch for extreme behavioral changes or any signs of suicidal thoughts. These signs should be taken seriously and a plan should be in place about how school staff should respond to such situation. The plan can be decided ahead between the child, parents, psychologists, and teachers. Next strategy the next strategy the next strategy is accommodate special needs. May children with bipolar disorder need to visit the school nurse regularly for medication or talk to a school psychologist, and especially for children taking lithium may need to carry a water bottle and have unlimited access to rescue. Next, agree on a safe place person. Children suffering from bipolar can feel overwhelmed and anxious, or they may be unsure of how to deal with their strong emotion and feel out of control. It's important to establish both a safe place and a safe person they can go to in times of distress. Allow them access to leave their classroom on their own. And that would be all. Thank you.